prayers. Most High in Christ bless you all. My name is Sister Naya, ma'am, from the house of Soldier Tamir, and I am an RN BSN. My current specialty, and I guess my forever specialty, because I'm actually starting school in October to be a midwife and a women's health nurse practitioner. I am currently a labor and delivery nurse, but I also do postpartum and antepartum. We triage patients, so we function as an ER for pregnant women. We see patients also with gynecological issues, which means they're not pregnant, they're just having some female issues. But today I'm going to be talking about some pregnancy concerns that have been kind of going around lately, especially with all the COVID stuff. So one of the top things that's very confusing for some pregnant mommies is a change in taste and smell. Well, a change in taste and smell, that is a very normal pregnancy symptom. Not everybody will have it, but some will. So that means sometimes the things that you used to like, you don't like anymore. And sometimes when things smell, like when you're cooking or something, it makes you nauseated. Also, when you're eating foods, it can also have a change in taste. That's normal. That can be from an increase in hormones. And also, sometimes if you have a day or so of a stuffy nose, which during pregnancy, you have a lot of histamine release just because you have all these hormones fluctuating up and down. Things are increasing, other things are being suppressed, and that can cause you to have a loss of taste or smell. But it shouldn't go on for weeks at a time. So if you have any concerns with a loss of taste or smell, and that's kind of a new finding, then I definitely would talk to your OB doctor and let him know that you are having, because we've had some women that actually tested positive, and that was the only symptom that they had. So this is not to scare you. This is just so you're aware. That way, if you are positive, you know there's a certain things you may have to wear a mask whenever your newborn is born, and that just puts the baby, that makes the baby safe. Because we don't want the baby to be getting sick. Even though when you're breastfeeding, you are giving your baby all your antibodies, and that is the number one protection for a baby is that breast milk. The other thing, some of the common concerns we see are contractions during pregnancy. Well, you can have contractions for a lot of different reasons. So if you have some rough sex with your husband, or it's a little more forceful, that can actually bring on contractions. So what you probably want to do is try to drink some water and try and rest and see if those contractions resolve. One of the biggest thing is water, food, and rest. So drink about 40 ounces of water. So, you know, those big pitchers we give you, drink about that amount of water within like 30 minutes. You want to rest at least an hour and see if those contractions resolve. And the other thing is nutritional needs. A lot of times you forget to eat, you forget that you're not just eating for yourself, but you're also eating for that baby. So that can actually cause some issues in your body. So you want to make sure also, if you don't have enough water intake, you could be more susceptible to urinary tract infections, which also can give you contractions. So you want to be very aware. You want to drink pretty close to a gallon of water a day, especially as you progress in your pregnancy. The other thing is questions about exercise. Can I exercise? Well, if you've been exercising before you got pregnant, as long as you talk to your physician, and which most times he will be perfectly fine with it, because if you've been exercising, you're nice and strong, and there should be no issues. But if you fall into the category where you've been exercising, but now you're having some preterm labor issues, then that's a whole different discussion, and you need to talk to your physician. Light exercise like walking is okay, but you don't want to start anything new unless you speak with your physician. The other thing is that you'll have a lot of aches and pains. So as the baby gets bigger, you'll have a lot of stretching and your muscles will be getting tight. So to counteract that, you also want to do some pregnancy stretching. You can go online and look up pregnancy stretching, pregnancy yoga. Of course, we're not going to be doing the whole thing, but the actual stretches that they teach you are very good. Not only that, but like prior to having sex, your Lord can like press into your legs and open those up. bring your legs up, and he can help you to stretch. He can press down on your back. So those are some of the things that can relieve some of those aches and pains. Another topic is I haven't felt my baby move. Well, below 28 weeks, the baby is pretty small. So you might feel some flutters, but sometimes you're not going to feel a full kick. If you do, and that's your normal because you're very thin or you've always felt it, well, that can be concerning. But what you want to do is drink a little bit of juice, something that's cold or sweet, and then you want to wait. And you want to count 10 kicks within an hour. So you time a whole hour and see if you feel any movement. Now, the other thing is sometimes, your body is changing, and so the uterus can start flipping. And so what you want to do is make sure you know where your placenta placement is. Some people have a placenta previa, which means that the placenta is the presenting part. And also you can have what's called an anterior placenta, which means the placenta is in front. So when your baby goes to kick, you're not actually feeling your baby, or the placenta is low, which is mean it's the presenting part. And so if the baby's kicking down there, if the baby's head up and feet down, you're not going to feel those kicks. So make sure you know how your placenta is lying, because that's going to make a huge difference for you. Okay, well, once again, my name is Sister Naime, House of Soldier Tamir, and those are just a few main topics that I always see in the hospital. So please, if you have any questions, you can find me on Telegram, and I know there's some other sisters in other schools that are also labor nurses or perinatal nurses. Okay, thank you. Shalom. Most High in Christ bless you all.